OrthoNeuro is a multi-specialty center of excellence that has been around in Central Ohio for over 80 years. We're the oldest practice, long-standing practice in Columbus, Ohio.
So we do any comprehensive musculoskeletal care that someone may need. And that certainly goes from anything from very simple, workups and diagnosis to physical therapy services, advanced imaging services, injection therapies, and then certainly a full array of surgical services as well.
But when pain gets bad, it's hard to do nothing. And the orthopedic urgent care is nice. That's an avenue to get people in, initiate treatment that's appropriate by somebody who's educated in orthopedic and musculoskeletal problems to get them to where they can get back to living their lives and be happy.
I think that's what makes this group really hum. You've got experts in every field. There's specialties for hip and knee surgery, foot and ankle, hand and elbow, shoulder. And so you have a unique group of orthopedists that have really the next level of training that comes with the fellowship training.
Well, I think the fellowship gives you an extra year to really focus on a specific area or problem, and so that can often provide the patients with someone who has some specialized training and maybe a more acute understanding of the problems affecting that particular area.
Low back pain is second only to the common cold, so everybody gets back pain at some point in their life. And so, I tell patients for the majority, you're not going to require surgery. But if it comes to surgery, we have the least invasive approach to get you back to your life, where we have active research. We're researching doing patient surgeries on an outpatient basis to get them in and out of the hospital and facility and get them back to their lifestyle and active lifestyle as soon as possible.
I think that orthopedics has changed a lot, where a lot of things were inpatient surgeries. Now so much of what we do is outpatient, but more and more all the joint replacements that used to spend days in the hospital, the hips and knees are often being done in the appropriate patient as an outpatient.
Believe it or not, most people, even hospital-based patients that need to be monitored for other previous medical conditions, can recover and go home safely in a same-day fashion. For patients that have minimal medical problems or are otherwise younger and healthier, we can actually do these in surgery center environments, which is actually probably the majority of the surgeries that we're doing anymore, where they can recover and then go home in a same-day fashion. Patient satisfaction is excellent with same-day recovery surgeries, often much better than people that stay within a hospital facility anymore.
What I'm most proud of is patients referring their own family members to us. And that's because they trust us. They trust us with their own families, just as we would hope that we treat them like our family.
The most important person in that room is the patient. A patient is everything. A patient's care is everything. That's how deep and ingrained patient focus is at OrthoNeuro, is that without them, we don't exist. So they are the front and center of everything that we do, period.